There is never have been enough discussion on the disease that is one of the world's leading causes of death and with a growing burden. In 2021 alone, 10 out of the 20 million people diagnosed of cancer globally died in what the WHO called crossing a disturbing threshold, and the figures are expected to rise in years ahead. Over 70,000 cancer deaths occur annually from over 115,000 diagnoses in Nigeria. Scary figures and a call to urgent action from all. The World Health Organization itself admits that care for cancer, like so many other diseases, reflects one of the many inequalities of our world. Comprehensive treatment is available in more than 90% of high-income countries, but in less than 15% of low-income ones where Nigeria is categorized.
When we look at the statistics, it becomes very, very scary. According to the recent Global Cancer statistics, where over 124,000 cancer cases were recorded in a particular year in Nigeria, over 70% died that same year.
But there is no giving up, especially with private initiatives like the BRICON Foundation that seeks to improve survivorship and quality of life for cancer patients in the country.
Many of you may be familiar with my story of my mother who had terminal cancer 4 times, who the doctors told her she would die 4 times, and she lived for 33 years after they told her she was going to die. She then died within 6 weeks of a leukemia diagnosis in 2013. 6 months after my mother passed away, I received my own cancer diagnosis. And what was interesting was that I had a gut feel that there was something wrong. And that cancer diagnosis basically changed my purpose and the course of my life forever.
I had cancer, was diagnosed in 1981. I was lucky enough to be in Denmark at that time and to receive appropriate treatment. Abigail didn't mention it, but she also was in Europe. She was in England, and she received the treatment. And when we came back here, we got together and we looked at the facilities available here for cancer patients, and we were horrified.
Cancer is scary, all admit, but the advocacy that the promoters are embarking is to demystify the discussions around it and focus on treatment and care, not just for sufferers, but their loved ones as well.
So we have a support group for women called the BRICON Whole Woman Project. And this provides one-on-one counseling. We do a lot of seminars. Women encourage each other, they share their stories. And this has been a really useful tool for women to get out there and not be ashamed. There's still too much stigma associated with having a cancer diagnosis.
Efforts by BRICON since it was founded in 2016 have included sourcing for funds to treat patients like 39-year-old mother of 2 Kehinde Olusoji, diagnosed of breast cancer in 2019, and 13-year-old Anita, who has also been cured of the disease.
All through the journey, I've been so fortunate to be under the financial support of BRICON Foundation. And to this moment, even though I've not finished my treatment because of inadequate of funds.
They have been helping us up until this moment with the treatment and every other thing. And also from the help from my church, they have been treating me.
But the resources aren't enough for the demands that come to the foundation on a daily basis. That is why it is spreading the advocacy to bring more Nigerians on board to close the funding and care gap for patients.
Please, out there, if you're screening, please keep some money for treatments. If you're going to help to diagnose, please help to treat.
That the gap actually does affect you or someone in your community if you were to look hard enough or listen hard enough. We can, however, close the gap. The reality today is that who you are and where you live could mean the difference between life and death. And it isn't fair, but we can change this.
One.
The unveiling of a special fundraising campaign logo for a sum of 50 million naira is a significant aspect of these events. It is a starting point to expand the care available to cancer patients and those who care for them. It is to be extended to more Nigerians across different platforms, including the social media. The target is to get the awareness across that contributing to the care for a cancer patient now may just be a contribution to one's or a loved one's future care if the culture is properly instituted, since the disease may call on anyone at any time. Tokunbo Oyetunji, Arise News, Lagos.